there is mounting pressure from the medical community to reinstate mask mandates in certain settings. This comes as hospitals are being flooded with sick kids amid a perfect storm of viruses, staffing shortages, and the scarcity of critical medicines.
It's an incredible strain on the system that no one expected to happen this time of year.
The strain on hospitals continues, with some children's emergency departments seeing an 80 to 100% increase in daily visits. Dr. Kashif Pirzada is a Toronto ER physician and tells me people in general are coming in sicker. Majority of the patients are kids, and the shortage of pediatric beds is causing a ripple effect.
We're having to put kids in adult spaces now to treat them. That's taking beds away from adults right now. And I'm afraid that if this trend continues, we're going to basically have to pick and choose who we treat in the future.
You think it could get to that point?
Already, so in an average emergency room, we only have a few beds to take in new critically ill patients. If I have an ambulance of a bay full of 15 people waiting for that bed, I will take the young child who's struggling to breathe over almost anyone else. And so it's already happening right now in any emergency room in this city.
Right now, a combination of viruses is hitting all at once, including flu, COVID, and RSV. And Dr. Pirzada says mask mandates in certain settings, such as schools, are needed now to help slow the spread.
We have this tool in front of us that we can use. Now is the time to use it. When the curve of cases and admissions is almost like a straight line up, that's when you use something like this.
As the shortage of children's fever medications and antibiotics continues and will likely continue into the winter, the CEO of the Ontario Pharmacists Association also believes the provincial government should take action.
I do think it's time to take a closer look at bringing back mask mandates. We're at a breaking point, so more needs to be done. There's no question about that.
Toronto's Board of Health has also asked the city's top doctor to urgently consider reinstating mask mandates, but Dr. Eileen de Villa says she's following provincial guidelines. And at this point, the province is not considering the public health measure.
I've always said from day one, I'll always listen to Dr. Moore's advice and get your flu shot. Get a vax shot too. I'm going to head out there and get my fourth one. I'm going to get a flu shot because I can't chance it. Old guys like me, I'm not chancing it.
Now, we're just learning that the Children's Hospital of Eastern Ontario, CHEO, has opened a second ICU to help with the overflow of sick babies and toddlers. In early October, Ontario's Chief Medical Officer of Health told City News that he would not hesitate to bring back masking if there was a strain on the healthcare system. Today, we were told by the Ministry of Health that Dr. Kieran Moore continues to monitor the situation.